Hi there, and welcome back to another edition of ScaleUp Radio, the podcast inspired by the Entrepreneurial ScaleUp System and designed to make navigating our scale-up journeys that little bit easier by learning from others' experiences. I'm Kevin Brent, and today I'm joined by Mark Kotter, neurosurgeon, stem cell biologist, and CEO-founder of BitBio, and co-founder of a number of other companies too. And Mark shares how BitBio is coding cells to become specific types for new cures and for research tools as well. And he discusses the major cultural shift that he had to go through, and so did some of his colleagues, in going from academia into business, focusing on teamwork, communication, and decision making. And as BitBio grew from a small team, initially 3 or 4, to now over 200 employees, Mark highlighted the importance of purposeful hiring and evolving organizational structures. And he nicely outlines the different phases that the business went through. And he also emphasizing fostering an open, trust-based environment for rapid innovation. So you're going to love this episode, and you're not going to want to miss any future episodes of ScaleUp Radio. So you can subscribe to it wherever you like to listen to your podcasts. You can also nominate a guest for ScaleUp Radio, like Mark, if you know someone with an interesting story, and you can find out how in the show notes. For now, tune in for insights on scaling a deep tech company from a true pioneer in the field. Welcome to another episode of ScaleUp Radio. I'm delighted today to be joined by Mark Kotter. And Mark is a neurosurgeon, a stem cell biologist, and he's the CEO and founder of BitBio, the co-founder of Meetable, the co-founder of ClockBio, and the co-founder and trustee of myelopathy.org. So that's a bit of a mouthful, Mark. What on earth does your day look like?
Thanks so much for having me on the podcast.
Thank you for joining me. You're most welcome.
Well, yes, I'm still a doctor, and I still see patients with spinal cord conditions, and this is where this mouthful comes from. Myelopathy is a condition which is a slow motion spinal cord injury that's caused by degenerative changes of the neck. And actually, seeing that I don't have sufficient tools or remedies to offer for patients with spinal cord injuries, really inspired me to go down a research track and then ultimately spin out these companies. This wasn't planned, this happened, but I'm really grateful to have the opportunity.
Great. So what does your typical day look like? I imagine you're very busy, like a lot of us, but you've got those companies that you're looking after. You've got your day job as well. So what does your day look like?
Well, so I would just want to clarify. If you sit on a board, that means you check in ever so often, and it's not really a day job. So the balancing act is really between BitBio and my sort of clinical/university. Yeah. And here, of course, I'm an academic neurosurgeon, so that means my clinical work is very specialized and constrained. So it's very important to be safe and do the right thing. So I'm very specialized in spinal cord injuries and conditions of the neck. And that allowed me then to also build the research part and ultimately the company. And the jobs couldn't be more different, quite frankly. As a surgeon, you've got something to do. You've got a patient in front of you. You want to help him as best as you can. Surgery is often, a point in time where you do something, but of course there's the pre and the aftercare, etc. But ultimately, you get a reward pretty fast. You do a good job, and you can see that your work was worth something or brought value to someone. On the science side and on the company side, it's very different. You often have very long-term objectives. You pursue certain strategy. You want to sort of crack a difficult scientific problem. And of course, the company gave me an opportunity to increase the resources to work on this very, very big problem, which is at the heart of BitBio. Scientifically, you could say, we're trying to figure out what cell identity is. How can you create knowledge that allows you to translate pluripotent stem cells into the stem cells that are needed, whether it's in the context of a therapy or in the context of lab research where you just want to work with human brain cells or liver cells or other cell types.
So when you say the concept of cell identity, does that mean that you can almost tell the cell what you want it to be? Is that what you're saying?
I think this is exactly what I'm trying to say. So you did it much more eloquently. Yes. So pluripotent stem cells have always been thought, and correctly so, as the origin of all cells in the human body.
Yeah.
And they've been discovered 26 years ago. But really, we haven't seen the breakthroughs that we were hoping for. There's no therapy in the clinic at the moment that's based on this technology. And actually, the uptick across the research community hasn't been as profound as you would have wanted. And it boils down to one big problem is, a stem cell itself is not very helpful. If you transplant that into a body, it creates a tumor because it's undirected.
Right.
And if you sort of put it into a lab setting, then it's not the cell type that you're interested in, because most of the conditions, let's think about neurological conditions, you need the brain cells, not the stem cells. And exactly that transformation of the pluripotent stem cell to the cell type that create our body, the mature body, has been so difficult. Based on a paradigm called directed differentiation, which really tried to mimic what happens during embryonic development.
Okay.
And BitBio is built on a paradigm shift where we no longer pursue developmental biology. It's more like a coding approach where you activate genes that determine cell identities. So, for example, there's a transcription factor. If you activate that, the cell will turn into a muscle cell. Yeah. Or there's a bunch of transcription factors. If you activate them, the cells are becoming pluripotent stem cells. And so we're coding cells to become the cell type of interest. And then using that to create, research tools or therapeutics.
So I would imagine that the potential clinical applications, when you get this right, are enormous.
Yes.
Yeah. And does that also mean that we can simply rejuvenate dying cells as we age as well?
I think conceptually we're made of cells. When a disease strikes, cells get damaged or they get lost. And a cell therapy, therefore, has the potential to address really some of the, most challenging health problems. What we haven't achieved yet is translate that into real clinical use cases, apart from an area which I didn't expect at all, which is cancer.
Yeah.
So we were able to, not we, but the scientific community were able to build cell therapies that are curative for certain end-stage cancers, which had no hope until then. And so this is the first, real move into a new paradigm where we have living drugs rather than, the dead molecules, which are have also been, revolutionizing medicine. Of course, biologics or the previous generation, which were small molecules. So I think you're right. This is a new modality. We're at the very beginning of that new modality, and the opportunity is incredible.
Yeah. So presumably things like dementia and things like that might be potential applications when you can make the brain.
I would start with some things more simple. For example, you have a liver injury and you
Okay.
want to replace liver cells. They're a lot less complex in terms of the architecture.
Yeah.
You could think about maybe localized neurological conditions. So there's been a study that show that intractable epilepsy that emanates from a focal point can be
Right.
treated when by putting in dampening neurons, GABAergic neurons, and that's been life-changing for individuals. Parkinson's, again, we have
Okay.
a focalized point. You lose dopaminergic neurons, and they can be replaced. And a partner of us, Blue Rock Therapeutics, has shown that patients can benefit from this treatment. Diabetes is another good example. You lose your pancreatic islet cells, they produce insulin. Actually, if you transplant pancreatic islets, then you can cure patients from diabetes. So we're just discovering what this new modality can do, but it's very exciting.
Fantastic. So you've been in this field all your life. When did you start BitBio?
So that goes back to 2018. And I was an academic. I am an academic at heart, and we discovered this new approach based on other people's work, of course, in the university. So we were entering the field of cell programming. That's really what we're doing, and tried to figure out how we can make it scalable and more robust. And we found a way of doing so using, keep it very high level, genomic safe harbor sites. And then I thought, wow, nobody expected that you can actually create such consistency and instruct entire cultures of stem cells to become nearly any cell type, at least the ones that we tried, three of them. And so I went to the university and said, is this something that could be of interest to others?
Right.
And at that moment in time, it was a bit uncertain because it was very novel technology. But then I became more and more convinced, and nobody wanted to license it. So I decided to spin it out into a company, and there you go.
Okay, so take us through some of the, what are some of the challenges that you face in what's, this is a highly scientific area. Any of this research is presumably extremely costly to run and get it running, and you're dealing in a world with patents and lots of regulations, particularly once you get into actual therapy. So take us through some of the challenges that you faced along the way since 2018.
Okay, the first thing, of course, is recognizing that this is something that you really want to spin out. That's a big one because it's a big decision, because it means that you suddenly get very distracted, and you just need to think very hard whether it's worthwhile. But I got convinced that this technology has something, and I could see how it could have an impact. And then I think an important question is, and I learned this the hard way, what do you want to do with this technology? Do you want to build a company that you want to sell? Is this a company that you want to build for the long run? So this is a key decision that will be forced on you unless you make it yourself at an early stage, because if you need to be clear about this as you gather people around you that build a company. The company really are people. So you need to gather people to create this engine that will develop the technology and translate it into something commercial. They want to know where this ship is heading. And it might be, it can easily create a conflict of interest if you, for example, have long-term perspective and a co-founder of you might have a short-term perspective where they want to see much earlier. And this is something that I faced very, very early, had to learn, had to, essentially purchase some of my shares, and then sort of in order to take it to the next level. So that's one thing. The second thing, taking something from academia into a commercial setting, what I learned is that the culture has to be completely different. So academia is very competitive, but it's also often very individualist. In a company, that won't fly. It's a team that you need to assemble, and it's teamwork. And so you have to really relearn, the context in which you operate. Mind you, I've always been more on the collaborative side in the lab as well, and so it wasn't that far of a fetch. But we did see that some people that come from academia into the company find that very, a very big change in terms of the culture. So then you have this idea. Before you actually have the opportunity to learn all of these things, you realize you only have that idea. And how do you now gather the things that you need to build a company? So people, money. And you realize that actually the only thing that you have is yourself and a story that you want to tell in order to entice people to join you on your journey. And I think that is also something that's, you learn. I've had the chance to go through an accelerator program at the university where they talked about the pitch and how you sort of pitch a company. But really what that means is that you think deeply about what you're building, why you're building it, who can benefit from it, and in such a way that you can communicate it so that it's enticing for others. So it starts with the word, and we've seen this in a different book as well.
Yes. Okay, so
at the beginning is the word.
Indeed, yeah, that's true. Okay, so how what did you learn about that experience then, going through the accelerator? What sort of things surprised you?
Well, it was a completely different language, a completely different set of problems. You learn about cap tables and balance sheets and things like that. So, of course, you need to learn that new language, but it's sort of logical with it itself. So I think it's something that if you wrap your brain around, isn't too difficult.
Yeah.
What you then learn very quickly is there's two major things. If you are like a deep tech company like us, the science is going to be super hard. Otherwise, someone else would have done it before. But what's even harder is the people. So you scale as you scale from the early stage startup to maybe crossing the 25 people mark all the way to the 70, maybe 120. There you really see a completely different problem set emerging. And so companies have phases, and this is sort of described. I mean, there's books about it, but it's different when you read it than when you actually feel it as you go through these different stages.
So tell us about some of those phases and what sort of stage are you at then with Bit By Now? How many people are there in the company?
So we're about 200 people now. We've raised about 200 million so far, and we are at a sort of late stage of the scale up. That means we are commercial, that we have products, we have customers that like our products. We can see how the demand grows. But of course, when you start out at the seed stage, you have concepts. You might have a technology. You might have a patent or a way to get to patents around this technology. You might have a use case for it, something that you think it might be useful for. Often you will learn that actually what you initially thought isn't the thing that you actually then are going to commercialize. So you have to be very open-minded. It's more about developing a potential, making sure that you have, especially in IP-rich environments, freedom to operate. You have your licenses in place. You've got your IP lockdown. And then you sort of create prototypes that you try and get into customers' hands. In our case, that were scientists of a company called Charles River Laboratories, who's a big CRO, who were very kind to us.
CRO being a clinical research organization.
That's right. So they do preclinical research, they also have an interest in stem cell derived cell types. So they were happy to look at these at a very, very early stage when we were, a 3 human band, essentially four people in the company. And then you learn and you get positive feedback and negative feedback, and you think about it. And what we achieved with our seed round was, which was about 4 million. We were able to create that framework where we have a company, the technology was successfully transferred. We were able to create a minimal manufacturing paradigm. We found that what we had resonated with the people in the lab that wanted to use it. And then, of course, you think, hey, what else can I do with that? So the second stage, which is then the Series A, was really to prove out that we can generalize this technology. It doesn't only work for one cell type in our context, but it works across different cell types. And the fantastic thing about this paradigm shift, where we move from traditional biology to programmable biology, we talked about instructing cell identity with transcription factors, is that you can bring the discovery of cell type programs in-house. Because instead of trying to figure out developmental paths by trial and error, you can screen for transcription factor combinations. There are about 2,000 transcription factors in the human genome. Okay. They regulate the activity of all the genes, and you will need to find the right subset. And what we know about 1 to 6 define a cell type. So the search space is 2,000 over 6, which is a high dimensional search space.
Yeah.
But you can think about now building an engine that creates very large scale experiments. So our last experiment involved single cell sequencing of 1 million cells, of which, we can read out up to 5,000 genes. So you've got, 1 million times 5,000 readouts. And then, of course, that requires ML to interpret the data, because it's way beyond what a human can comprehend. And so that's our discovery platform, essentially. So we built the early version of our discovery platform with our Series A money. So yes, it's transferable. Yes, we can create new cell types from scratch in-house. And then the ambitions became even bigger, and said, okay, now we have that engine, we can do that. The question that investors will ask is there product market fit, and what are the markets?
Yeah.
And so for us, it's human cells can be used for drug discovery and toxicology. So, and why is that enticing? Because 90% of drugs fail. We use mice to develop drugs that treat human, and human biology is very different. So we can expect a lot of fallout there, especially when it comes to disease, because human disease is even more different to mouse disease than I think physiological sort of balance system. Right. So yes, we were able to show actually the opportunity to really do drug discovery using human cells. And then the ambition is, hey, can we also show that this is a useful thing for a clinical, for the clinic? Can we get one of our cells into the clinic and treat patients with that. So that was really the remit of our Series B.
Very good. So very scientific, and you're I confess you're losing me along the way a little bit, but I can see some of the power there. So part of what you're saying with the drug discovery is, instead of having to test in mice, we can test on human cells, but actually outside of human, because we can replicate the human cells, because we can switch on the types that we want, and we can then test drugs against those, and whether they perform in the way that we would hope that they would perform, but without having to put into mice or into humans.
That's exactly right. And I'll just give you some numbers for the more commercially minded. At the moment, on average, 2.5 billion are spent to get a drug into the clinic, and that includes the failure rates, the failed attempts. If you just double the chances at the beginning by picking the right starting point, the right target, as we say, you can halve the costs nearly.
Okay.
So imagine the industry then has $1 billion more to spend on developing the next drug.
Yeah.
So instead of one, you get two. And of course, you think that the advantage that you're going to have using human cells at the onset over using mice and rats and cancer cell lines is a multiple. So I think it's a very crucial thing to have for pharmaceutical development.
Yeah, and I imagine part of that cost saving is also a time saving, in that we've got a limited patent life on a product, haven't we? So the quicker that we can actually get it through all of the stages, then the longer we have left on the patent if we're a pharmaceutical company.
Probably, yes, absolutely. Although they still need to obviously go through the clinical trials.
Yeah. Excellent. So you mentioned people a lot. And you've grown incredibly rapidly from 2018 and now up to 200 people or so in what, six years ish. So tell me about some of the challenges and things you've learned about scaling that rapidly, and particularly from a people aspect.
So initially, when we were a small group of people, I certainly made some tremendous mistakes. I thought everyone that joins will be excited and aligned, and will have the same vision, building this big, forward-looking company. And then, I talked about it. I very quickly learned that not everyone has the same ambition. And so what that means is you need to be very explicit and tell people up front, look, this is what we're trying to do here. And this is, what we're trying to achieve. And please join us if you buy into the strategy and the vision of the company. But equally, what's extremely important is that your set of values is similar, especially if you think about building something over the long term. And so from thinking that this is an automatic, it'll happen anyways when people join the company and see the potential. I flipped the other side, to the other end, and said, we have to be extremely careful who we let into the company,
right?
And be very, very explicit with our values. So we chose in BitBio for major values. One of them being purposeful, being ambitious but towards the purpose, not self-ambitious, being trustworthy, trusting forward and collaborating, and then being empirical, so facts above opinions.
Yeah.
And that still serves as a sort of coordinate system for our actions. And we spent during the early scale-up period, up to about 120 people, at times 60% of our time to recruit. And we had a very staged approach where people would be having first interviews, then a number of what we call culture fit interviews, and then a final interview, and then a joint group discussion, and then even a secret vote to ensure that so that that we maximize the chances that someone will join the company that is a good fit. Often it's 10 plus interviews for a single position.
Wow.
But we felt this was very helpful because it allows the candidate also to understand what the company does and how it works, and vice versa. So we were hoping to minimize the prizes at the other end. But of course, it was a heavy lift, so to speak. So we were starting to add people. And we went from, let's say, a handful, 5 to sort of 20. And around that period of time, you can see something shifting. So, and in these transition periods, you don't see them coming. You don't feel them. They just happen, and suddenly you are a different company, and it's a different way of communication. So, the first stage, I would say, everything is shared, every knowledge is shared. You sit around the table, you're basically discussing everything with everyone, and everyone feels completely in the loop. So it's easy in some ways because you have these open discussions and the information just trickles to everyone. When you then get to the next stage, which is around 2025, that suddenly breaks down. So just because 25 people can't be there all the time, you've got people outside looking after sales, people working in maybe in production, etc. Suddenly you notice that information isn't following the same pattern. It can't be as, let's say, bidirectional, because you need to be a bit more purposeful in terms of making sure that it reaches everyone. So your communication style changes a little bit, and the information channels change a bit. You can still do with relatively limited structure, but it starts to feel like you'd have to broadcast a bit more. So you're sort of saying, you're emphasizing a few things more often than you did before, to try and see that everyone is on the same page. And then that stage again, seems to be, quite steady until you reach the next inflection point. And that was, I think, between 80 and 100, some around that time, where everything again fundamentally changes, because now you not only need good, consistent communication, it's just not going to flow the way that you want, because maybe it starts even earlier, maybe 45 people or so. So it's more gradual, but you sort of tend to find that you suddenly need to start thinking about structure. And it's been quite, I can remember a period of time where, we had a happy company. This is in lockdown. We sort of scaled quite considerably during the COVID period. And everyone was feeling extremely excited and positive. And then within a week, the entire thing changed.
Wow.
And friction was occurring. This is my job. No, this is my job. This is my responsibility. I thought this, I've always done this. So suddenly, that implicit trust that everyone is doing the same changes somehow, and people require more structure. Okay, this is your responsibility. That's what you are accountable for. This is how you interface with the next. So then it's high time to think about structure.
Yeah.
And of course, what structure means is that things become more reliable, but maybe more efficient. But you lose some of the flexibility that is so nice at the early stage of the startup. And for us, this coincided with finding out how we do our work, and then transitioning into a structure that would enable our work. So
Yep.
In this case, the technology was so new. Nobody's done this before. Nobody knew whether this could be transferred. Nobody knew how to create a platform that can screen new cell types. So we had a bunch of scientists essentially exploring all different avenues, and then as that transition happened in terms of size of the company, thank God, we sort of also transitioned to understanding how the pieces of the puzzles could come together. And then I also realized that, maybe I'm not the right manager for this. I need a second in command who is a very good manager and knows how to put processes and structures in place.
Yeah.
I was very lucky to recruit Catherine Corso, who was head of cell therapy development at Takeda, so a big pharma company. She has a background in drug discovery, launched a few products took them all the way into the clinic, and really knew how to build highly functioning teams in a very complex environment.
Yeah.
And so we sort of started to embed these structures in the company, and then the mood changes, and people, enjoy being here again. They have their own remit, and so we've got a matrix structure where you have line management and we have program management to really enable everyone to do their best job. But it's an ever-changing thing as well.
I love the way you've described that transition, actually. Really, really good. And what have you learned about how do you think about team sizes? Have you got any particular rules about sizes of teams as you've scaled to keep maybe the units within the overall business functioning as well? What have you learned about those?
I think the only rule that we are implying not more than 6, maybe 7 reports.
Yeah.
I think that's when you start to see that people are perceived as spreading thin. If you've got too many reporting to you, then it becomes a set of instructions rather than a partnership. And I think it's very important, especially these very complex things, that there is partnership. You delegate the decisions up that you can't take yourself, but you should. So one of the things that we're trying to do very much and encourage that people should take decisions wherever they can, and not sort of raise them. But there are decisions where multiple teams might be affected, and that of course needs to be coordinated. So structure is really to help balance across the organization, but ideally decisions that are done at the hot phase, where the questions or the problems arise.
Yes, that balance of giving people the empowerment to make their own decisions, but equally not in a way that then might, without thinking about the knock-on effect on other parts of the business, is a challenging one in itself, isn't it? Yeah.
I mean, a lot of the build is also involving trade-off decisions and prioritizations. So Catherine again came up with a centralized prioritization framework where things are agreed, and that brings people together. And then it becomes clear. We also of course have yearly goals, quarterly goals. We incentivize people to see those goals. So we have taken these learnings into account, and that's still constantly upgrading and evolving. At the core, however, I think the company is still very much the same in terms of the value. So when you look across BitBio, you see there's a phenotype here. So I would call it the communicative nerd. So the scientist or the technician or the sort of the deep thinker with a twist that they actually like talking about what they do. Right. And that creates a really interesting atmosphere. And then, of course, still, we're looking very much people that want to transcend themselves, not not fulfill their personal needs, but actually have a higher purpose that aligns them to the mission of the company. So BitBio obviously is coding cells for novel cures. That's sort of the tagline.
Okay.
So then that means if you're a scientist and you're really interested, let's say, in the scientific problem of cell identity, yes, your purpose matches into this. On the other hand, you might be someone in finance who wants to do and work on something that is meaningful. Okay, again, that creates an umbrella. You want to commercialize a new breakthrough technology and enable scientists or patients. Again, that's a really sort of great motivator for commercial people. But it really only works when you have a sense of your own purpose. If your own purpose is to be selfish, then it really doesn't fit that much into BitBio. So we've sort of been able to really recruit extraordinary people that have this passion to change the world, and who are ambitious to drive towards that.
Excellent.
Trust and collaboration is another big thing, I think, which is very difficult to embed. I mean, trust. There's two different kinds of trust on that. There's this, I have known you for the last 10 years. You've always been on my side. I call this the mafia trust. That's not difficult. But what's really difficult is, I don't know you, but I trust you. And
Right.
so you can do mistakes. And if you do mistakes, and I give you 3 lives or 7 lives. And if you say, I'm sorry, if we can chat about it, you get your life back, you see. That creates a very thriving environment. Very difficult to really go all the way, and I wouldn't say we're completely there, but I do think we have a very trustworthy and trusting environment in BitBio.
Yeah, and that is sometimes referred to as psychological safety, isn't it? Where we feel comfortable in admitting our mistakes, knowing that we're not going to be vilified for it, and therefore we can share it and admit it when we get wrong, in the whole aim that we can learn from it and improve.
And especially in science, where the norm is that things go wrong, and then you have to communicate that and learn from it. And actually, if I look at myself, I've really only learned from my mistakes. The bloodier the nose, the better the learning in some way. So we really wanted to encourage people to be able to voice their opinions. There are boundaries, though. I think just being negative is not a good thing. I think you need to talk about things, not about, it needs to be substance. And so we learned that that's also different. People that are, some characters like moan, others, want to solve problems. And that's a different kind of openness that we're trying to, again, sort of encourage. The healthier the debates, the faster your progress. And we really try to also make sure that hierarchy doesn't play a role, that people can stand up and that the ideas will be heard. Now, outside of science, more often than not, someone who has a lot of experience will be a bit more often right than someone who has, little experience. So there's this, believability question. So I'm drawing obviously here on principles from Ray Dalio, who has also built an organization that is based on radical openness, and we're trying to sort of do something similar here.
Right. Very good, very good. Well, yeah, absolutely fascinating stuff. And what is the legacy that you want to leave with BitBio?
Gosh, so look, my dream as a doctor was that we open up this door to regenerative medicine, and if so I'm still at heart a medic. So if we could bring benefits to patients, that would be that would be amazing. That's what we're here for.
Yeah.
What I realized is that there's two ways to impact. You can develop a therapeutic, and BitBio is doing that also in collaboration, very much in collaboration, because the funding requirements for these drugs is enormous.
Mm-hmm.
But also just the research grade cells as tools that others can use to create medicines, I think is hugely inspiring. And if we could become the standard set of tools that people use, like now antibodies are used, everyone used to have their rabbit to create an antibody that they then would use for their research. Now nobody does that. Everyone just goes to Abchem, for example, another UK company. We want to make the use of human cells really easy, so that it doesn't become that huge bottleneck that it is at the moment. And hopefully that'll speed up drug discovery, that'll create more opportunities for patients faster at a lower price. So that's really the ambition here.
Excellent. Fantastic. Well, I've learned a lot and feel inspired talking with you, Mark. So thank you very much indeed. Are you up for a quick fire, a couple of questions before we close?
Sure, go ahead.
Good. So if you could go back to your younger self, what advice would you give the young Mark Kotter?
I think I would tell him it'll be fine, it'll be okay. And it's okay if you have to walk through walls. Just pursue what you think is right.
Good.
And you'll be okay.
Excellent. Like it. You mentioned a couple of people already. What books or podcasts or learning resources would you recommend others to read? So
I sort of read a lot of philosophy in the past, and I did wobble between becoming a musician or a mathematician or a medic.
Right.
So I still draw on some of the concepts there, and I think the exposure to different things allowed me to, and I'm here in the UK. I chose to be here in the UK, although my accent reveals that I'm not from here. Rethinking who you are, where you are, rethinking your ways of thinking, trying to challenge yourself, trying to learn new things, I think is probably the most important thing to do.
Okay.
Read something that is completely outside of your interest or comfort zone, to sort of and learn from it. I think that's probably the biggest advice I can give someone.
Outside of the lab, because I'm guessing you've got all sorts of specialist software and things within the lab, but maybe outside of that, what sort of apps or bits of tech would you recommend others to look into?
Apps, I think at this moment in time, of course, we see this revolution in AI, which touches everything. And we have AI in BitBio, and we're going to strengthen it considerably now, because it provides solutions that, a few months ago, I still thought would be unimaginable. So I would encourage everyone to play around with, some of the large language models, ChatGPT, and see what they can do for you, whether it's on the private side or whether it's in the company side. I have a funny thing to share. So I downloaded the ChatGPT, and when it started to talk, which is very recent, I think it's now silenced because the voice is too close to an actress. But I started to have a conversation. It was around midnight. My daughter didn't want to go to sleep, and I sort of said, ChatGPT, I don't know what to do. My 16-year-old doesn't want to go to sleep. And the thing answers that, hey, this is a typical thing for 16-year-olds, they have a different wake cycle. And I said, well, that's all fine, but she's got GCSEs at the moment. And then the thing comes back and says, yeah, well, this is a very important exam. Maybe you should have a chat with her why she doesn't want to go to bed. And then I said, and then the thing said something about maybe, there's some anxiety that sort of prevents her from going to bed. So my daughter listens to the conversation, bursts out in laughter. I go back to the app and say, well, it doesn't look like it because she laughs. Well, you should still sit down with her and have a chat, because sometimes our anxieties are sort of a bit deeper and it takes time to explore them. So, I mean, mind-boggling. Imagine this, and this is exponentially increasing in what it can do. And then think about how you could apply this across the board. Write a summary of that. Do this. Maybe very soon we'll instruct things to do shopping for us, and so I think there's a massive and you can challenge yourself with these things as well.
Brilliant. And finally, perhaps, who's had the most influence on you, would you say, as a business leader?
I would credit a number of people. So one thing that I learned from my PhD supervisor in Cambridge, when I came from Europe, it was a very hierarchical structure, and he was not like that at all. And in fact, he was a person that deeply respected other people and treated them as equal, whether you were first year PhD student or a late stage postdoc. And then also when I look back into my family, that there's such a mix of different peoples and backgrounds. I think that learning that the dignity, the respect for people needs to be ground up. Whatever they do, I think you just need to. There is something incredible in others, and that deserves respect. And I think if you approach whatever you do with that mindset, whenever you interact with people, then I think you're on the right track.
Brilliant. Very good. Well, Mark, thank you very much indeed for being my guest on ScaleUp Radio today. If people would like to reach out to you perhaps, or find out more about BitBio, what's the best way for them to do that?
Of course, we have a website, we have LinkedIn profiles that you can connect to, and we're sort of putting out new information as we go along. So I'm very happy to sort of listen and hear and interact with your audience.
Great. So we can just tell people to go and look for BitBio, and they'll be able to find that.
And there's a LinkedIn profile. I've got my personal LinkedIn profile. So.
Mark Kotter, thank you very much indeed for being my guest on ScaleUp Radio today.
Thanks, Kevin, for having me.
I hope you enjoyed that discussion, and if you're building and scaling your own business, you might well be interested in our book, The Entrepreneurial ScaleUp System. And it's exactly what it says on the tin. It's a practical handbook around scaling a business in a structured way. And you can order a copy on all your favorite online retailers, including an audio version, or you can find it and other supporting resources on our website, www.esusgroup.co.uk. That's esusgroup.co.uk, which is esusgroup.co.uk.
This has been a Monkey Pants Productions podcast.